In this video, I will be dealing about the benign and malignant tumors, salivary gland tumors, cysts and tumors of odontogenic origin, as well as bacterial, viral and mycotic infections. In this video, it's a synopsis of all these things, like all the syndromes related to benign and malignant tumors, your salivary gland tumors, cysts and tumors of odontogenic origin, all the infections like bacterial, viral, mycotic, all the syndromes related to all these are discussed in this video, along with their features as well as along with their clinical pictures. So let's start with the very first one, that is very first benign and malignant tumor, that is Cowden syndrome. So what it has? Cowden syndrome has oral papillomatous lesions. So as the name is suggesting, papillomatous, papillas are involved. So if we're gonna see clinical picture, it was gonna look like this. Papillas are involved and the lesions like this, that is oral papillomatous lesions. So oral papillomatous lesions plus there is facial trichomoniasis associated with GIT, that is gastrointestinal tract, as well as there is thyroid involvement and CNS abnormality. So what do we mean by facial trichomoniasis? Let's see to this. Facial trichomoniasis can be look like this, like if you find something like this on the face, clinically it looks like this. So this is your trichomoniasis. So this is our Cowden syndrome, that is oral papillomatous lesions, that is tongue involvement, as well as facial trichomoniasis with GIT, as well as thyroid involvements, like any involvement of thyroid, as well as CNS, that is your central nervous system abnormalities, that is present together in Cowden syndrome. Then we have BK mole syndrome. So what is BK mole syndrome? It's like a mole type of thing, which is a large pigmented area and which has a very high risk of development into melanoma. Okay, so clinically, if you're gonna see there, you're gonna see some areas, pigmented areas like dysplastic nevi. Okay, so these areas they have very high risk for the development into melanoma. So this can be a BK mole syndrome. Now let's talk about another thing, that is MEN1. Now what is MEN? MEN is actually a short form of multiple endocrine neoplasia syndrome. So multiple endocrine neoplasia, like multiple glands, endocrine glands are involved and there is neoplasia of them. So in MEN1, we have many types of MEN. In MEN1 type, we have this hyperplasia of pituitary, parathyroid, adrenal cortex and pancreatic islets. So there is involvement of pituitary gland as well as parathyroid, adrenal and pancreas. So all these glands, tumor occurs, that is hyperplasia. Then we have MEN's 2, that is Sippel syndrome. In Sippel syndrome we have involvement of parathyroid, but here there is hypoplasia of parathyroid. Plus there is pheochromocytoma. So what is pheochromocytoma? It's actually the cancer or a tumor of adrenal cortex. Adrenal cortex tumor is pheochromocytoma, and then there is medullary carcinoma of thyroid, like medulla part of thyroid is involved. So it has three things: thyroid involvement, adrenal involvement, and parathyroid involvement. That is meant to Sippel syndrome. Let me show you. It's a short table that you can recognize the things. But yeah, it's not properly correct because it's actually a Google picture, so you cannot rely it properly, but yeah, you can learn from this book. So these are the benign and malignant tumors. Now let's jump to salivary gland tumor. In this we have only one syndrome, that is Sjogren syndrome. And Sjogren syndrome, I know that you have heard of it many times since from your third year. It has basically three things with it: keratoconjunctivitis sicca, xerostomia and rheumatoid arthritis. So what is keratoconjunctivitis sicca? It's actually a disorder related to eyes and it can be seen like dry eyes. Can you see this? Like the conjunctiva appears to be red and irritated. So this is the keratoconjunctivitis sicca. Then we have xerostomia. As you everyone know about that, this your xerostomia is dry mouth, like saliva formation doesn't take and rheumatoid arthritis. So all these things come together in Sjogren's syndrome. Then we have cysts and tumors of odontogenic origin, in which we have only one, that is Gordon-Gall syndrome. Gordon-Gall syndrome, also called as jaw cyst, and Cell-Nevis or bifid rib syndrome. So it has four things with it, that is Gordon-Gall, jaw cyst, Cell-Nevis, bifid rib syndrome, and in this we have multiple OKCs like odontogenic keratocyst. Do you know what odontogenic keratocyst is? It's a cyst basically seen in the posterior regions of the jaw, mandible. Basically, you're gonna see radiolucency in the X-ray, and it is mostly unilocular. Okay, so that is OKC, as well as there is basal cell carcinomas all involvement. Basal cell carcinoma also occur. That's a carcinoma due to light, like sunlight related. Then there is bifid basal rib, and there is neurological problems, that is brain and all the nerves related problem, ophthalmologic problem like eye involvement, and there is sexual abnormalities. So yeah, if you can see here, like basal cell can be seen like this. If you're going to differentiate basal cell from squamous cell, it's going to look like this. So on the skin, this kind of thing can be seen clinically, as well as I have told you, that is this kind of thing. OKC, if you're gonna see the radiographs, you're gonna see something radiolucency, which may or may not be involving the teeth, and sometimes OKCs are also confused with radicular cyst and all. And then there is bifid basal rib seen, and all these neurological abnormalities like Parkinsonian disease or Alzheimer disease, or like all these spinal cord and brain related disorders, and ophthalmologic and sexual abnormalities. Now after this we have bacterial, viral and mycotic infections. In this we have Hereford syndrome, we have Behcet syndrome, we have Reiter syndrome, we have Ramsay-Hunt syndrome. Four syndromes are there. Very first is Hereford syndrome. In Hereford syndrome, we are going to have only one characteristic feature, that is ovuparotid fever. Ovuparotid fever. In Behcet syndrome, we have three things. That's a triad actually. We have ulcers, recurrent ulcers, oral ulcers. We have recurrent genital ulcers, and we have ocular inflammation. That is, three things are there. Recurrent ulcers of oral cavity, recurrent genital ulcers, as well as eye involvement, eye inflammation, that is gonna seen in Behcet syndrome. It's very much common in children. Then we have Reiter syndrome. Reiter syndrome, in which we have four things. We have urethritis, that is infection of urethra, arthritis problem, we have conjunctivitis, eye problems, and we have oral ulcers. So when all these four things come together, it's gonna be Reiter syndrome. And at last we have Ramsay-Hunt syndrome, and it's actually a herb zoster infection of geniculate ganglion is involved, and with the involvement of external layer and oral mucosa. So I can show you all these here, like Hereford syndrome. It's basically ovuparotid fever, but yeah, also along with this there is parotid gland enlargement and uveitis and facial neuropathy, and yes, you can see like this. So these are all the together features, but yeah, characteristically you should learn about ovuparotid fever. After Hereford, we have learned about Behcet syndrome. In Behcet syndrome, you can see oral ulcers, genital ulcers, eye involvement. So this, it's a triad of recurrent oral ulcers, genital ulcers, and ocular inflammation. And then we have Reiter syndrome. It's actually a tetrad of urethritis, arthritis, conjunctivitis, as well as oral ulcers. That is mucocutaneous disease also. And at the last we have Ramsay-Hunt syndrome. As the name is suggesting, Ramsay-Hunt syndrome, there is external ear as well as oral mucosal involvement. So ear involvement as well as oral mucosa involvement, and the face look like this. So yeah, that's all for today, and I hope you like the video, and if you're new on my channel, then do subscribe it. Thank you.